My name is Mohit Turagam. I'm an associate professor at the Mount Sinai Hospital in New York City. The title of my talk is The Impact of Posterior Wall Ablation with Pulmonary Vein Isolation in Patients with Persistent AF, a Manifest PF sub-study. Manifest PF is a large collaborative effort of 24 European centers who first started to use the pulse field ablation catheter since commercialization in Europe. The importance is typically posterior wall ablation, which is a standard area for performing ablation in persistent AF. The trials so far using RF and cryo have been mixed. There are some studies which have shown benefits, some studies have shown it doesn't work. Again, showing the importance of technique in doing this kind of an ablation. Pulse field ablation is a novel, revolutionary technology which has significant safety and effectiveness. And the idea is to see if pulse field ablation helps by doing this ablation. The study was a retrospective analysis. It's a sub-study of the Manifest PF registry. And the outcomes was primary effectiveness outcome was 30 seconds of AF on follow-up cardiac monitoring, while the safety outcome was looking at major or minor adverse events. The baseline characteristics are very typical for any AF ablation patient. The mean age was 65, including about 40% were women, 80% had hypertension, 20% had coronary disease, 20% had diabetes, and CHA2DS2-VASc score was about 2.5, which is very typical for an AF population. The findings show that at 1 year follow-up, patients who received posterior wall ablation had a freedom from AF was about 66%, compared to those who received pulmonary vein isolation was about 71%, and the p-value was not significant. The take-home message is that physicians and operators should be careful about performing empiric posterior wall ablation in all patients with persistent AF and should approach this as a more selective basis. The next step is obviously to perform a large randomized trial to actually compare the safety and effectiveness of this kind of an approach.